So we teach many owners how to administer subcu fluids to their animals. Subcu fluids are generally administered for animals who have chronic kidney disease. Each time you refill your fluids, you should receive a bag that looks very much like this. This is a 1,000 ml bag. Each number denotes 100 mLs. When you start from the top to the 1, that is 100. From the 1 to the 2 is 100, and so on. You will administer a quantity that is decided upon based on your animal's severity of the disease and weight. You'll also receive a number of needles, generally 10 or 11. These needles are sterile. Each needle will have a cap on the base that prevents it from becoming dirty because it's a sterile product. You'll break that cap by twisting it, and you'll remove the dirty needle prior to administering the fluids on each time. This area is sterile on the IV set, and this area is sterile on the needle, so you don't want to actually handle those or touch those. You'll place that on, and you can easily pull the needle off, or pull the cap off. When the needle is open or available, you'll be able to see the bevel, which is the open end of the needle. This part needs to be up. That's important for administering fluids. It makes it hurt less for each animal. After each application of fluids, you're going to leave your dirty needle on your primary IV set. Prior to administering a new bout of fluids, you're going to remove the sterile cap on the end of this needle by twisting. You will twist off the old needle from the primary IV set. You do not want to touch this end of the primary IV set or the part of the needle that is sterile. You will then apply pressure on the needle in the primary IV set and apply the needle. At that point, you can remove the cap on the needle, and you want the bevel, which is the opened end of the needle, up. And again, you do not want to touch the needle because it is sterile. So this is Skippy T. He's going to be your little helper today. So whenever you have your animal in front of you, you can basically administer the subcu fluids anywhere from here to about here. Most cats don't like this area being messed with. You can actually also administer it a little bit off to the side. It doesn't have to be right down the middle of the back. And you want to use a different area each time, just you don't want one particular area to become overly sore. So the next thing you'll do is you'll pinch the skin, gently pinch the skin, and create a tent. And you see my fingers, I'm not getting a huge amount of skin. I'm getting a little bit of skin, and I'm pulling that skin up. And that's the great thing about animals. They have all this scruff. So I'm going to create his tent, and I can actually feel where I'm going to place the needle with my finger. So I have my brand new needle that I've already changed out. My bevel is up. I pinch and tent his skin. I'm just going to pop that in there very quickly. The faster I go, generally the less it hurts. I'm going to go ahead and rest my hand on the back of Skippy T, and you see he didn't even jump. As long as you can do this in a confident way, most animals will be okay with this. I'm going to reach over and roll the ball up on my subcu fluids, which will then start the flow of fluids. Gravity is our friend. The higher the bag is, generally speaking, the faster the fluids will flow. He is a kitty, and his chronic kidney disease is pretty mild, so we're only going to give him 100 mLs today. So his bag is starting at the 6, and we're going to go down to the 7. After administering the fluids, you'll see a small ball that's going to form in this area. That ball can be gravity dependent, and it may go down on either side and even sometimes down into become a little bag of fluid in the leg. That's totally normal. If it hasn't absorbed completely in 24 hours, that's not as normal and something we would want to know about. Other things that can occur after you put your needle in is sometimes the needle will go in one side and out the other, and you'll get a river of fluid running down your animal. If that occurs, you go on the side where the water is coming out, and you just grab on the skin and pop that needle back up underneath the skin. And give it a good pinch and hold on to it just to keep that fluid from leaking out. Lastly, the other thing that can occur is once you've administered the fluids, when you take the needle out, sometimes you'll get a little bit of blood back, and that's okay. It just means that you went through a bleeder when you entered the skin. Again, just pinching, applying a little pressure, and that blood will stop. So Skippy T has received his 100 mLs. You can see he has a noticeable ball of fluid right here in the center of his back. So I'm going to go ahead and discontinue the flow of fluid by rolling the ball down on my bag of fluids. I'm just simply going to remove the needle, and sometimes I just give it a little bit of a pinch right here just to close off where that insertion was made. And that's it. I always leave the dirty needle on, and I cover my needle after administration.